A very good morning to all of you. First of all, on behalf of Selco Foundation, ASER and CEED, I welcome you all for today's webinar, which is on health and energy integration, and look forward to have a very productive discussion. Friends, as you know, that CEED has been working on this particular issue for last few years. We have been closely working with various government departments, including JREDA. And this DRE and health issue, this is something that we have started a new intervention. And this is the second webinar that we are organizing in that direction. As some of the people who are here also must have attended our first webinar that had happened a month and a half back. And I would like to update people what has happened since then. So the first webinar, which we did a month and a half back, post that we have had a discussion with Health Minister, Health Secretary, Director JREDA, Project Director JREDA, and some other department. And we got a very positive response from all the government department. And there is also a proposal that is there in front of them. And very soon we are going to work on that proposal. So I just wanted to update what has happened in the last month and a half so that we all are on the same page. Now, in this particular webinar, what we are looking at actually to explore how the health and energy integration can happen at a large level, especially for the state of Jharkhand, right? So this is something that we would like to discuss in detail. And in fact, we also wanted to have special webcast from the Honorable Health Minister of Jharkhand. But the day on which we are supposed to record his interview, on the same day he was tested positive for COVID-19 along with his PA. So this is really sad. So I take a liberty on behalf of all of you to wish him all the best and for his speedy recovery. Of course, he has told us to meet once he comes back from the hospital. And also the Health Secretary, Dr. Nitin Madan Kulkarni, also is very supportive and positive towards having an energy roadmap for health sector. And he also requested us to start a discussion once the COVID-19 situation in Jharkhand come to a manageable level. So, so we do have all the support and cooperation from the local department, and we need to work along with them to propose a kind of a roadmap where we can strengthen the health sector in Jharkhand with support of DRE. Going forward, I would like to actually introduce all the speakers to all of you. For today's webinar, we have 4 powerful speakers. We have Vinita Gopal, who is the head and CEO and founder of ASER Social Impact Group. She has more than 20 years of experience as far as the environmental campaigning and social justice are concerned. We also have Mr. Bharat Kumar Sethi, Senior Manager Health, Selco Foundation. I believe Selco Foundation doesn't need any introduction. They are the pioneer organization in the country in terms of developing innovative solutions for various sectors. Today actually, we'll be hearing from Bharat about how DRE can help the health sector. We also have Divya Kotidil. Divya, forgive me if I have pronounced your surname correctly. She is the Director Communication, Power for All. She heads all the campaign in India for Power for All. And definitely we look forward to hear from you about the overall communication challenges for the DRE, because you always struggle despite of the fact that we do have a powerful solution on the ground, but DRE doesn't give that space whenever any debate on renewable comes in front of us. So we look forward to hear from you. Last but not the least, we also have Mr. Vijay Kumar Sinha, the project director, along with other colleagues from JREDA, Mukesh and Nilesh. Vijay Kumar Sinha, the project director, he'll be joining in some time as he has some other meeting with the chief secretary and all. So I hope that he'll be joining by the time his turn come for, I mean, as a speaker. He is a well-known name actually in the Jharkhand Electricity Board. He was very instrumental in leading the Jharkhand Rural Electricity Program. And he's not new to Jareda. He has served in Jareda in past as well. And he is the one who is responsible for developing, the roadmap for renewable energy, as well as to manage for the implementation for the state of Jharkhand as well. So these are the speakers that we are going to have. But having said that, we would like to make today's webinar as a more interactive and a discussion kind of a webinar. Therefore, there are certain ground rules before I go to the first speaker. So what I would urge all of speakers to keep their talk to maximum 5 to 7 minutes, right? And because we have 1 hour and maybe we can extend by another 15 or 20 minutes. So I would request to have your talk brief so that we have more time for question and answer and discussion, right? And I also would urge all the participants to keep their mic mute all the time unless they are speaking, and also keep their mobile phone in a silent mode if their mobile phone is closer to their system and all. Also to inform participants that yes, there will be a question answer and discussion session. That's what I'm urging speakers to take less time and to have more time for discussion. And also to inform that there will be a recorded version of this webinar that will be available for all of you. In fact, we also have had the recorded version of the first webinar as well that was on our CEED YouTube channel. And we'll also share the link for this particular webinar as well. So this all as far as the ground rules are concerned. So let's start our discussion. And to start our discussion, I would like to start with Binuta. Binuta, as we all know that the deployment of DRE actually is providing a disruptive transformation in the energy sector. In fact, accelerating DRE always drive energy solutions that are basically more or less in the line of people's need, right? So it's very decentralized. It meets the local needs, and hence it is not about wires and poles, but it's about quality supply, right? And not only that, it also helps uh, economic activity. So, yeah, uh, may I request people to keep their mic mute? Yeah, so DRE is not just about having the poles and wires, but it's about the quality supply along with supporting lot of economic activity. Therefore, has a potential to revive the economy even in the present COVID-19 crisis and to do other economic activities as well. Yet, people are obsessed with grid-based electricity, right? So now, in your opinion, that when we are talking about this overall health and energy integration supported by DRE, so how do you see the entire sector moving towards a kind of an energy integration where DRE plays a major role, and we manage to convince the policy maker where DRE plays a critical role for the health sector, especially keeping in mind the state of Jharkhand. Vinuta. Binuta, you are mute.
Sorry, Rama, I think I missed the last bit that you said because of internet issues at my end. I'm switching off my video just to make sure that. Are you done? Do you want me to?
No, you can start. The last bit that I said that the DRE is a powerful tool, not just to provide quality supply, but also to meet the economic activities on the ground. Yet we all are obsessed with our grid-based electricity. So now in this kind of situation, how do you see the health and energy integration happening with support of DRE?
Yeah. Thank you so much. Thank you to CEED as well for organizing this, and to all the speakers. Um, um, I I wanted to start by saying that you know, at this time, like Rama said, when the numbers on COVID are increasing, we're still in the midst of the pandemic. And I think all of us are looking and listening and reading about what is it we should take and learn from this situation. So that we actually come out of it stronger and come out of it much more ready for the future. In some ways. So I think this conversation on health and decentralized renewable energy, whether it's connected to the grid or not, not getting into that debate, but basically how can we ensure that the health services that are so essential are provided in a way and that is most effective and that is also available to the person even in the last mile. I mean that the kind of services that we can sometimes provide only because the infrastructure is available only in cities or in smaller towns. How can we ensure that the infrastructure required is available across the country? I think that uh, renewable energy, because of the nature of the solution, that it is modular, that it can be decentralized, it can also be connected to the grid. It provides us a lot of flexibility in thinking about the solution. So I think that this is the time for us to look at how, as Ramapati said, not only look at decentralized energy or renewable energy targets as an end to achieve, as a goal to achieve for its own sake, but also see actually, which the Selco Foundation sort of, thinks primarily about, is how can we actually ensure that sustainable energy delivers the other essential goals, for example, health. So I think that the conversation today, and really looking forward to hearing from the project director of JREDA as well. But how can we make sure that the goals align between different departments? The ASER really believes that we need now much more collaborative ways of working, because our problems are very complex, and to solve these complex problems we cannot merely think of it from one perspective. We actually have to see how we can bring together and align the goals of different departments or different ways in which we are working, and different goals that each department or each sort of for example, the energy goals might well meet and align with the health goals. And we need to see where these collaborations are possible and make them happen. And for that, this conversation and many more are essential, because we have to actually work together to make that happen. These are not separate things. So we cannot necessarily see just the deployment of decentralized renewable energy without seeing how it can actually make some of the other things work much better. And if we did that, we would be much more effective. We would be able to pool resources better, and the outcomes that we can deliver would be far greater than if we were working in our silos. And ASER really wants to enable those collaborative conversations to happen. The other point I think I want to make is that even when we are looking at health infrastructure, it's not merely just the electricity delivery. It is also looking at how do we most efficiently design the system. So we should also look at vaccinations. If are there need for these vaccinations? Do we need cold storage facilities in these places? So what are all the solutions? Not necessarily merely just the solar panel on the roof of the health center. What are all the solutions that we need to design for to improve health delivery, and even make it more cost effective? So how can we make that happen? And I hope this conversation is going to be interesting and get us along that pathway. And we really do hope that Jharkhand has a real potential to show how this can be done. So we are looking forward to this conversation today. Thank you.
Yeah, thanks, Vinuta. I couldn't agree more that the convergence is the key in order to have a kind of a system in the place where better health services can be provided with the help of renewable. So yes, the convergence is something that we look forward to have it in the state of Jharkhand. Uh, Coming back to Bharat, to you,
Yes, sir.
as we all know that Selco has been working on a series of programs as far as for the health sector is concerned.
Yeah.
Uh, yeah, so from you, we would like to know as how the overall DRE solutions for the health sector, not just the point which Vinuta was talking about, that the panel on the roof, but the real solution in terms of providing health services such as the vaccination,
Mm-hmm.
solar chiller, and there are so many other things like baby warmer. So many things are there which can help the health sector to provide better services to the people. At the same time, how all of these solutions can be scaled up as well to meet the need of the state. So we would like to hear from you on that. I hope you have a presentation, right? Okay, good.
Yes, sir. Yes,
Go,
sir.
go on,
Yes.
Bharat, yeah.
Yeah, sure. Yeah. Good morning, everyone. And first of all, I really thanks for CEED and ASER for organizing this, and also Selco Foundation us organizing this really the meaningful interaction on the DRE, which is a need of an hour for the state like Jharkhand and also in many other states of India. I just briefly tell about what Selco Foundation has been working so far and how the DRE has made of meaningful impact on the healthcare infrastructures, especially in Jharkhand and also in other geographies. So as sir rightly pointed, hope you're all able to see my screen, right, sir? Everyone?
Yes, yes.
So as mentioned, basically, we see generally the health and energy is a key area. Both one thing, what when you see the health sector, there's a poor awareness on the energy solutions. What currently the healthcare staff is having, they may not be aware about these things. How energy can play a greater role, and there also the less capacity and also no trainings on the how this DRE can be like strengthened and implemented at the facility level. Third, basically, the use of not only as Vinita and Rama sir rightly pointed out, it not only putting solar panels, we also see what other equipments we should look into that within the facilities. How the energy efficient equipment can play a greater role in improving the healthcare setting. That's health sector. What there's a gap is there. And similar energy sector, when we say it, basically the lack of understanding what exactly need of a health center, basically what is real need for the energy, and also what are the various equipments are used and how it can be implemented. There's a gap is there. And also when we really implement this solar panels, we also need to prioritize the need of the PHCs, whether we should go for entire load or whether we should go for critical load only for the labor room. All those things are based on the need, basically. So to match between these things, the health and energy play a greater role. What Selco Foundation always believes in, basically an assessment makes an understanding, what are the critical needs of the healthcare facilities in terms of energy point of view, and also in terms of the energy equipments point of view. And based on the designs have been made, what solar design has been made and implemented in Selco Foundation. Now, coming back to the next question, basically, yeah, I completely agree what Rama sir and also the Vinita madam said. The whole issue of the convergence of the departments, not only I'm talking about the at the government level, it has to happen at the various in the technical design side, what are the various vendors available there within the market, suppliers, who are the clean energy enterprises, how we can really bring in them in this conversation and build the capacities, and also see what kind of buildings we can be building. For example, in case of Jharkhand, there's a lot of plan to come out of the upgrading of the health and wellness centers. And here, is there any scope to build these new structures, keeping the built environment point of view? That is something, and also for that we also need to build the capacity of architects, mason workers, and all those. And second part, the whole of a training and skills of the people who are working at the facility level. Third, basically, who are the NGOs who can really play a champion there, take this forward in the district. Basically, that is something very key for us to look into that, because someone has to really anchor the role and also see how it can be taken forward. Though the fourth point, basically, the whole issue of the bringing the ownership of the system, basically. That's the key in the long run. Basically, one is like the maintenance of the solar panels, and also the replacement of batteries of 5 or 6 hours. All those issues are there. But something we should really see how we can really plug in these aspects in the design. And also finally the policy levels. Now what Vinita and Ramas rightly pointed out, there has to be a lot of policy level to work both with health and energy department, like how both health and energy department can look into these very crucially, how they can develop a joint plan in their plans, basically, so that this issue can be addressed. These are the large ecosystem what Selco believes always in this approach. And the whole issue I mentioned, basically, in these states where Selco is working, largely we're focusing on a maternal care. That's a key for the India also right now, as we all know about that, especially in the state like Jharkhand, Assam, and also Meghalaya and Manipur, where we have to focus more on the SDG goals, focusing on especially on the maternal care, where Selco has and implemented the prenatal care. Like we have a lot of this like the outreach kits we have, which helps to provide services at the doorstep for the women, a pregnant woman who can't come to the health center because of the difficult terrain, and also the internal care in the labor room. What all services we can have an energy efficient equipments and provide better care, and also neonatal care with as sir mentioned, baby warm, phototherapy, and all those. These are some of the equipments very crucial, which has been mentioned in the IPH standard. I think we should look into that, and that needs to be strengthened, especially in health centers. And we also have we said basically we work at different level, basically at the grassroots level, especially RKS, ARS, and ASHA workers, and all district health hospital level, and also state. So these are various levels the Selco is really trying to work on the health and energy nexus. This is Jharkhand. I won't get much into this because we all know about these indicators. I think everyone knows about. I won't get. But Jharkhand is a state which needs to be, which one of the priority state needs. There's a lot of scope to work, especially when it comes to the health and the health ground. And these are the access to energy gap. What we find, what we know about the state, like this has been the various document reported. Basically, there are the energy gaps in the centers, health centers. Either few health centers don't have energy, the electricity, the grid power, and if some centers already have a grid power, they may not be having reliable power. That's the issue basically in the Jharkhand. Keeping in that mind, what Selco has been working with Jharkhand from last 6 to 7 months, we have these intervention in these places, in Giridih and uh, in Chatra, and also in Ranchi, and a few of the places we have these interventions with the Deepak Foundation, the Citizen Foundation, with the district administration. We are able to implement these solutions in the last 6 to 7 months. And these are the various partners what we have, which has been implemented under the kind of solar panels we implemented in these places, largely with health and wellness centers, Miso Hospital, and also the one mobile medical unit we have implemented. And this is basically the different months we implemented, and also cost, and also solar designs of these interventions. Coming back to the initial findings, because it's too early to do any assessment for us. Basically, it's just a 6-month-old. But we are really looking forward to do a detailed assessment of the impact, how it is going to helping. But overall, if you see the initial impact, if you see basically there were a lot of power cuts in these places due to rainy seasons, and they're heavy dependent on generators, especially in Navagra health and wellness centers, and also in Meso Hospital. And the staff were elected to stay in the night time because of there was no reliable power, and security issue was there. And due to erratic power cuts, sometimes the medical staff were not able to do a content delivery safely. And also it also affected the erratic power supply also affected overall admission services, like work at the health centers. After the post installation, there are some initial gains are there. Staff are saying basically now they are not much worried because there is some 24 hours supplies there, which if they are able to provide better services. In Navagraha, they stopped using the DG set. It seems now they are totally dependent on the solar, because having solar there. This reduces the cost of the even use of the diesel amount earlier. And similarly, in Mesa Hospital, it has come down from 20,000, 30,000, 20,000, because in Mesa Hospital, it's a big hospital. We only solar powered only the critical load there. And A&M started staying in the centers there, and because of having reliable power there. In all the health facilities, medical doctors, nurses, and experts, they are able to conduct delivery safely in the night also. and able to do a better administration work, because of having the, like, they can send reports online in the time on time, and also because of the having reliable power. Basically, these are some of the initial gains what we have, but we need to again further look into that, how really we can document these things. But there are other geographies we do have, we implemented the, as I mentioned, the last mile connectivity. This is a one of the kit what we have, which is called ANC kit, which is again is solar power one, especially in the geographies where mothers are staying quite far, like where they're not able to come to center regularly, and to provide better ANC, to provide the ANC checkup at the doorstep. This kit has been used, and here the ANM goes to house to house. She does all the tests to pregnancy, the BP monitoring, anemia monitoring, and if any high risk pregnancy, she'll be referring for the further to the health center. The reason, because this kit is very useful for in the geographies where the ANC visits are less. If you see the NFHS data, in Meghalaya, in Manipur, and also in Jharkhand, it is still the ANC visits are still the 4 visits what we mentioned as NHM or the MCH program mentioning. It's less than 60% what we find. This kit can enable that. Basically, I think we are really looking forward how this kit can be implemented in these geographies with especially with the health department and also other NGOs involved in there. Apart from that, we also have Sitling is another example. The tribal health facilities in case of in Tamil Nadu, where they had a OT, the operation theater they had, and they used to spend a lot on the diesels earlier. Then we developed a solar power system to support that operation theaters there. So this has really helped in reducing the diesel consumption every month, and that they repaid as an installment basis to the Selco Foundation. This is how it's been done and how DRE can play a greater role. And this also helped to provide a better service in the operation theater services in the hospital. And this is a CNS. This is one example I would quote here. This is in Assam, where the boat clinics are there. And boat clinics used to run, before that they used to maximum 8 hours availability they should spend. Before that they used to go for this provide services, but they used to come back early because the diesel used to get exhaust earlier, because all those facilities inside the boat clinic, the lab and all those was running by diesel. Later on, this was assessed, and the solar panel was implemented there to support the lab facilities of that boat clinic. And this has really helped to better to do them more round of services, and also reducing the cost of the diesels what the diesel consumption basically. This is another example impact what we have. So way ahead, as rightly mentioned, basically looking into Jharkhand geography, and also the power scenario, there is a lot of scope to integrate health and health energy nexus. What Rama sir mentioned, also Vinitha has rightly mentioned. And health and wellness center is one of the flagship program of India's right now under the Ayushman Bharat. And there are a lot of plans from the government to upgrade the health and wellness centers. So can we integrate these solutions in the right now planning itself, but discussing with the health and energy department, them bringing them together? That's one option. So I'm just way ahead. I'm thinking about that. Other thing, basically, there's also a wide scope to implement the DRE, especially in public health facilities, focusing on the maternal and child health value chain, basically, because maternal health is a serious concern in these geographies. That is something. Third, very important. The third and fourth point, basically, it's also need to couple with the capacity building of the staff and also ownership of this entire DRE system. That's something very key in the program, basically. Unless until you build that won't be it won't last, I would say, basically. And even the people at the staff at the health center should feel about the importance of that, how they should take care of these things. That's something which we want to highlight, which we are trying to do in Karnataka and other geographies right now. We have a MOU with RKS, where RKS is paying money for that for the maintenance and all those, and they're taking care of the solar panels and all those. Yeah. With this, I'll just stop. Thanks for the opportunity. And there is a lot of scope, as rightly mentioned. Selco Foundation also working. This is one of the geography areas for us in Jharkhand, where we would like to do some kind of pilots, especially we discussed last time also about these things. So how we can really build upon on that. Yeah. Thank you very much for the opportunity, sir. Thanks a lot. Yeah.
Thanks a lot, Bharat. It's good to know some of the innovative solutions supported by Selco Foundation, and also to know some of the ground realities of the health sector in the Jharkhand. The thing that you talked about, that we should have a kind of a value chain approach, is essential to decentralize the health sector. And so that's what we have a major takeaway from from your talk, where we focus on right from beginning, say like technical designing to training to services to finance
Yes.
and
Yeah.
policies. Kind of a complete value chain approach. So I think that's fantastic. So thanks a lot, Bharat.
Thank you,
Can
sir. Thank you very
can
much.
can you take out your slides from this?
Sure, sure, sure. I'll do that. Sorry, sir. I'll do that. Yeah.
Yeah. Coming back to you, Dibya, after listening to Bharat and looking at some of those fantastic solutions, especially I was really moved to have uh, a kind of a hospital on board. I mean, which can go say like in some of the area which is more or less waterlogged for a large number of days, say like in a year or so. But not only that, there are so many solutions that he talked about, and we also know that there are others as well. Having said that, we always have had a kind of a challenge that people don't have a very positive thing to talk about DRE. लोग बोलते यार छोटा है इससे क्या होगा? We are talking about things like that. So how do we amplify this real solution, which is not only meeting the people's need but also helping the economic activities, right? So how do we amplify these things so that the policy makers, decision makers actually take note of this solution and adopt in their policy to scale it up, say like in a large scale? Dibya.
Yeah, thanks. That's a good point. So we've already seen there's been a lot of successful stories in terms of states having implemented these kind of solutions for public healthcare facilities. But it's like you said, this is still not a mainstream idea. In fact, DRE itself is not a mainstream idea. If you look at, if you talk to anyone outside of the energy sector, they probably don't even know what you're talking about. And if you look at any media publication, or even if it's an energy focused publication, the amount of space that's given to DRE is comparatively pretty small. And as a sector, I think DRE is struggling, and now more than ever because of the impact COVID has had on small businesses and then in turn the end consumer. But this is actually a missed opportunity because of like Vinita mentioned, these systems are modular, and there's an ease of deployment, and just the overall affordability and reliability of these systems. I think clean energy solutions do have a strategic advantage in being able to solve this issue of unelectrified health centers fairly quickly and affordably. But how do we change this sort of narrative? And we've already said we've seen states that have demonstrated this. And there's a range of benefits to these interventions as well. There's a Selco report that talks about tangible and intangible benefits that DRE systems have on healthcare service delivery. And there's a lot of stories around this. There's a lot of stories to be told. And I think it's in communicating these successes or highlighting lessons learned and engaging with the right stakeholders at various levels. This has the potential to serve as a catalyst for scaling up these interventions. But the thing is, communication is more than just about telling these stories. We need to be telling these stories to the right people and also engaging with the right stakeholders at various levels in order to ensure success. One of the things that we need to recognize is that we also need the right people to be telling these stories. I mean, for the longest time, DRE has been something that the energy sector has been talking about. So we've been telling ourselves these stories, but actually DRE impacts and benefits other sectors. And in this case, healthcare. Just even on this panel, we're mostly energy folks discussing healthcare. But what we actually need is healthcare professionals talking about why this is such an important issue, or why lack of power supply affects their ability to serve. We need champions from the health sector to be pushing this agenda so that, when there's a health center that doesn't have electricity, the solution they're looking at is not diesel generators or, as backup or even their primary supply, but they're looking at, deploying sustainable energy solutions instead. I think a good example of that is recently we had this group of about 20 organizations from the healthcare and energy sectors, and a lot of them are part of this call today. Got together to publish an open letter calling for government to act on this and making the case for solarizing unelectrified sub-centers in rural India. I think it's about 39,000 sub-centers currently that don't have electricity. And this helped mobilize support from various stakeholders, including government officials, to help further this. I think it's like when you have people who actually live this reality on a daily basis, get them to talk about it, those stories become more real and going beyond just what you and I can talk about as non-medical professionals, which is not to say that we don't need the energy sector. I mean, of course, Selco and others have been doing a phenomenal job in the health space as well. And this is my final point, and I'll stop there. But I think the other speakers have also talked about this sort of collaborative effort that's really required, and we need this multi-sectoral approach, not just from civil society or from the private sector, but also at the government level. I think demand is generated by the health sector and the solutions by the energy sector, but the ground level implementation has to be an integrated approach, but you also need clear ownership. And I think that's what will ensure success.
So thanks a lot, Divya. I think, yeah, I mean, you are right. I mean, we need to identify the champions who talks about the solution, and nothing better than the health professional themselves. Because, I mean, I myself have seen some of the hospitals who are completely running on solar, and they are also undertaking some of the critical uh, like operations, heart surgery that I have seen, which is completely powered by solar actually in one of the hospital in Gaya. And there are solutions, but we need to have those people coming forward and talking about those solutions. And maybe at some point of time, we'll be able to bring them out and create some kind of impact on the policies as well. So thanks a lot, Divya. Do we have a Bijay Sinha sir with us, or he's come back, or?
No, sir, he hasn't joined, but we have Mukesh Prasad with us, the executive engineer from Jareda.
So we have three people from Jareda: Mukesh ji, Nilesh, and Sanjeev.
Nilesh, Sanjeev sir is from Creda.
Okay, from Creda. Okay, fine. Okay. So since PD sir has not joined, so shall we wait for him, or Mukesh ji will speak, and whenever that sir joins, he will say
Yes,
his.
yes, sir. I think we should continue and ask Mukesh ji to speak for this.
Okay,
Yeah.
मुकेश जी, जैसा कि अभी हम लोग बात कर रहे थे और इसके पहले की तीनों वक्ताओं ने जो अपनी बात, हेलो मुकेश जी,
हेलो हेलो
हाँ जी,
is I audible?
yes, you are audible. So
Actually,
basically,
there is net issue and I have trying to connect many times and I am getting disconnected.
right. Okay, so let me just what we would like to know from Jareda, as all the speakers talked about, as how we can basically look forward to have a kind of an approach where other departments also work with JREDA to have a kind of program to strengthen the health infrastructure in the Jharkhand. It's not just the job of JREDA, other department also has to be a part of such initiative. At the same time, we also need to have a kind of overall value chain approach to think about right from beginning till the policy level, and there are so many other things that has to happen within that. So keeping in mind that, how does Jareda see actually a nodal agency for the state to take a lead to develop a kind of a roadmap which will basically
Just not yet
the
now.
entire health infrastructure? Nilesh ji,
Meeting.
audible?
Hello. Hello.
Mukesh ji and Nilesh ji are together.
Hello.
या मुकेश जी, नीलेश जी, हम ये जानना चाहते हैं जरेडा से,
Yeah. Tell.
अगर हेल्थ सेक्टर को झारखंड में अगर रिन्यूएबल एनर्जी बेस्ड या डीआरई बेस्ड अगर बनाना है, तो हाउ डज जरेडा सी दैट काइंड ऑफ अप्रोच एंड इनिशिएटिव?
Okay. Thank you everyone. Myself Mukesh Prasad, Executive Engineer Jareda, and thank you for inviting us in this very interactive and informative webinar. We already acknowledged the importance of DRE to meet the energy demand in Jharkhand. As we all know that in Jharkhand, we have a lot of problems when we talk about energy, especially in electricity demand of Jharkhand and how we cater the energy demand of Jharkhand. We have already electrified so many villages of Jharkhand through this DRE program, and we have also electrified so many health centers. Approx 157 number of health centers have been electrified by Jareda. But I admit that we have not specifically targeted the health sector. We are already doing this DRE program for so long, and there are so many schemes such as Saubhagya scheme, DDG, that is decentralized distributed generation scheme, through which we are providing electricity and trying to meet the energy demand of rural areas, and other government buildings. We have already electrified almost 970 buildings through this DRE scheme. But now I think that it is time that we should especially focus to meet the energy demand of health sector through DRE, because we know that the health sectors in urban area, especially in big city, they generally have the facilities to meet their electricity demand. But when we especially talk about rural areas, rural villages, then we already know that electricity is a very basic requirement for any health sector, health clinics, or any related sector. But in rural area, it is very difficult to meet their electricity demands through conventional source of energy. So and now, as due to the technological advancement and reducing the cost of generation of the solar energy, it is now very reliable and viable to look into the DRE system to meet the energy demand of health sectors of health sector. And but to meet the energy demand of health sectors through DRE, it is very important that there must be a better collaboration among the health sectors and we the energy sectors people. Without a proper collaborations among us, it is not possible. It is not possible and not feasible to successfully run any DRE schemes in Jharkhand. Why Jharkhand, in anywhere. And for this, although we have experience and we are already running so many DRE schemes, but if we have to focus, and we must, I think we must have to focus, especially health sectors, to rectify through DRE schemes, DRE projects. Uh, First, what we have to do, we must have a joint meetings with the health officers, higher level of health officers of Jharkhand, and we must have to plan and a proper we must have a proper framework so that we may run this DRE schemes in health sectors. And for this, I think there must be a details study and details a report must come out And I think CEED will surely help us in this. They are already helping us. They have already submitted so many reports, and we are expecting that they will further help us to frame out details report to cater the health sector demand through DRE. That's all.
Okay,
Thank,
thank
thank.
you. Thank you, Mukesh. I think it's really good to know from you that JREDA does recognize DRE as a powerful tool to strengthen the health infrastructure in Jharkhand. And in that regard, the last 3 points which you said, which is really, really well appreciated. At the point that you said that we need to bring the health department into the discussion, which is very much needed to have like health and energy department going together to suggest a kind of a framework. And yes, as you rightly said that we are going to work on a kind of energy roadmap, and we'll definitely work with JREDA and health department to have a kind of a framework or a report or a document which gives us a kind of a long-term direction and a vision for DRE as far as the health sector in Jharkhand is concerned. So thanks a lot, Mukesh ji. Ashwini will still wait for Vijay sir to be here. Whenever that he comes, we will give him a floor to speak as well, right?
Sure.
Okay, so I think good to know from all the speakers about the points which they have brought in as far as health and energy integration for Jharkhand is concerned. So now I'm going to open this floor for question and answer and more like again for open discussion. But before we go for like an open discussion, may I ask people if they have any specific questions to the speaker or something that was not clear to them when they were talking about. So are there any questions to the speakers? They can type their question in the message or they can just unmute themselves and can talk. Baljit ji, do you have anything to say? Does anyone have any questions to the speakers?
We have Saksham, I suppose, who would like to share something. And Sanjeev ji from Chief Engineer from CREDA, he
Right.
also would like to point out something.
Okay. So is Saksham here?
Yes, I'm here.
Yeah, hi Saksham. Yeah, nice
Hello.
to meet you. Yeah, I know
you too.
that. Yeah, I know that Forum for Future is really doing some good stuff as far as this DRE issue is concerned. So Saksham, very briefly, do you have any point or any message to share with this particular group which can help us, our initiative in Jharkhand? Very briefly.
Yes, I'll be very brief. Thank you. I think the only thing that I'd like to say is, in terms of our communications and even how we talk about success stories and the impact that we are having, it's very important to bring in the outcomes focus in. So, moving beyond household connections and certain number of hours of supply, what is that electricity supply enabling in terms of health services? How is it? How have we seen the change in health services over the last 5 years with the Saubhagya scheme now, being successfully implemented? How have we seen strengthening of primary healthcare centers? How is equitable electricity access affecting their responsiveness and their preparedness to the pandemic? So that's something which is really important to highlight here. We've also seen some really good success stories, not only with DRE solutions being primary, but we're also seeing DRE solutions coming in and acting as sort of that bridge between, let's say, for example, 12 hours of supply or 14 hours of supply to making it 24 hours of supply. So it's also important to highlight, the role that DRE can continue to play in bridging the gap as well, and actually becoming part of the mainstream. I think one thing to be very careful of is that we don't, we corner ourselves into a place where DRE is looked at as something which is separate. It's really, part of the mainstream.
Are there any other questions or reflection?
Sanjeev,
Yeah.
Sanjeev Jain would like to share something. Say he's chief engineer from CREDA, Chhattisgarh Renewable Energy Development Agency.
Good afternoon, Aswani and all participants at CEED. I am from the Chhattisgarh Renewable Energy Development Agency, is a nodal agency of MNRE for implementation of the renewable energy projects in the state. In fact, we have electrified more than 1,200 health centers in Chhattisgarh, including community health center, primary health centers, and sub-health centers. We call it a village level infrastructure for the health facilities. And we have started this installation since last 15 years with the help of the MNRE, Ministry of New and Renewable Energy Sources. As we were doing the village electrification program, and we saw that these infrastructure like school buildings, like health centers, like Anganwadi, they were not covered under their schemes, and we have installed solar photovoltaic power plant in the nearest health centers of 1 or 2 kilowatt. What we feel it helps a lot to ensure the health delivery and health facilities in the health centers. We also found that after putting the power plant in the health centers, health staff are able to deliver all type of facilities in night also, and they were able to stay in their health centers in night also. And about 3 years back, CEEW, Center for Energy and Environment, they have conducted a study, and they found that after the installation of solar photovoltaic power plant at health centers, that improves a lot in terms of the delivery cases, in terms of the all other cases, and this has been recognized on the international level also. And we have got the Astan Award in 2018. And after that, the state health departments and realized the importance of this photovoltaic power plant health centers. And now they have made mandatory in all health centers, particularly in community and primary health centers, solar photovoltaic power plant in the health facilities. Issue is that the capacity assessment, because the most of the health centers we are not able to assess how much capacity of the solar photovoltaic power plant is required to cater their energy need. Because some of the primary health centers are very overloaded, and some of the primary health centers, they are not being served as per their requirement. So it is very difficult to assess the capacity of the power plant. In spite of that, we have put a power plant of 2 kilowatt for the primary health centers and 8 kilowatt in the health center, community health centers. And now we are getting the requirement of the capacity assessment from the concerned health officers to increase the capacity. Now we are doing at our own from the health department support. And operation maintenance is really a serious issue, because it requires the off-grid systems, and it requires the battery replacements. And that is a very costly affair. It requires a lot of money. And since this is not on a priority of the health department, as a nodal agency of MNRE and state energy department, we are maintaining these systems from our own. But unless and until the health departments own this facility, own this infrastructure, like other facilities being owned by the health department, this photovoltaic power plant cannot last for a lifetime like 25 or 15 years. So health department collaboration and involvement is must. Without that, these DRE solutions cannot be maintained, cannot be operated. Belongingness from the health departments, involvement of the health department is must. In last, I would like to mention here that before putting DRE installations, we should make the health infrastructure, health facility energy efficient. We have a lot of technology. Since we are doing the energy conservation, energy efficient building, green buildings, so we should first make the health sector, health facility, health infrastructure energy efficient by implementing the all passive and active measures. And second major point on which Selco is doing a lot, energy efficient equipment, all type of equipment, like we are doing the LED street lights and LED indoor light and energy efficient fans and energy efficient racks in refrigerator storage system. In addition to that, most of the health diagnosis instrument, health apparatus, they are not energy efficient. So organization like Selco, that they should look how to make it energy efficient, because the health departments or health persons are not worrying about the energy efficiency of the equipments that they are using. In spite of that, most of the energy efficient equipment is already available in the market and they are being practiced in the private hospitals. But in government hospitals, they are using the old technology equipments. So this is to be looked after. Thank you very much for patience.
Thank you, Sanjeev ji. So there are some questions that I have received actually in the chat message. So there is a question from Abhishek to Jareda. Mukesh ji or Nilesh ji, if you are there. Is Jareda considering a scheme for social application for healthcare like solar chiller and solar baby warmer? So Jareda की तरफ से कुछ इस तरह का स्कीम के बारे में कुछ Jareda सोच रही है, मुकेश जी?
Yeah, actually, kya hai ki last bar we have just put a proposal for this, and on behalf of that, actually one project we have already started. Exactly, that is not basically for the health sector, but it can be used. That is solar cold storage system. And regarding other things, I think proposal is on the way, and we will launch in the next financial year, most probably. Exactly, we are just planning for the cold storage project, and this can also be used for the health sector a lot.
Okay.
Hello.
Yeah. Okay. Thank you.
Yeah.
Yeah. So there are two questions that I have in my mind. Like we talked about various kind of models and solutions for the health sector, but the financing is something that we always see as a major challenge because as Sanjeev ji was also talking, I know that the Chhattisgarh Renewable Agency has done quite a lot of remarkable work as far as solarizing the health centers are concerned. But most of the time, what we have seen that because of the lack of fund, things have not moved to a desired level. You know, for example, if you're talking about the baby warmer, or say like some other instruments such as a solar chiller and all, there is always a kind of debate who is going to fund such kind of initiative, whether it's the fund will be coming from the health department or whether Jareda will put or any other SNA will put their money. So how do we basically unmask this whole funding things in order to have a deployment of DRE solution in a large scale? Anyone can say, either from the speaker or anyone who are expert over here, maybe Saksham or anyone who has any view on this whole financing thing for DRE solution. Yeah, Bharat.
Yeah, that is very pertinent point what you're bringing, sir. Basically, if you see I don't know, maybe some public health expert are there in this forum. If you see the IPHS standards, there are a set of equipments the PHA should have, right? I think only thing it's a baby warmer. I don't know it's mentioned or not, but a couple of other equipments already there. Only thing basically, yeah, this is something I think we are always in a challenge when we really go for scaling up. See, scaling up for the DRE, putting solar panels is fine. Okay, we can talk to the Jareda or CREDA or ORIDA or whichever department. Ultimately, when you talk about the efficient labor room, at least in few of the states, I'm not talking the states which we are really focusing right now in the northeastern and also the state like Jharkhand. In those, the health department, if we able to showcase, demonstrate some of those what has been done from our experience and also maybe from CREDA experience about using such medical equipments. That one thing I think we should really strongly push to the health department so that the procurement, it's all ultimately lies the procurement basically, and see how they can really change the policy when they purchase the equipment, medical equipment basically, or also the utilities like bulbs and tubes, what Saurabh mentioned basically. That's something which is really a I think key issue in this, and that is something I think we should really look into that. Only way to influence the policy ultimately it has to come from the health department, what account to me. Because it's in the PHC and the asset belongs to the PHC, public health facilities, a PHC or a CSC, wherever they're implementing right now. But this is something which is really going forward. I think as even Saksham was rightly mentioning, basically we have to come up with the evidence of this equipment we used, maybe quick studies on that and convincing the policymakers about this, and see how it can be incorporated in the procurement policies. That's something we should really look at in the long run. Ultimately, the health department has to put in money for that. This is what I would say basically. Yeah.
Right. Thanks a lot, Bharat. So just to inform all of you that we still have some extra time, so we can go on. I will go to Abhishek, to you. Like I remember that we were talking about utilizing some fund from, say, like district mineral fund or something like that. Is this something that the JREDA can use for deploying DRE solutions in Jharkhand?
So Rama, Jharkhand is one of the state which has the highest amount of district mineral fund. Odisha is the largest and Jharkhand is the second largest. And somewhere around 2,500 crores is sitting idle into quite an extent in a different district, which can be utilized. JREDA definitely can utilize this resources because in the last couple of years, most of this money are being utilized for public sanitation and for drinking water purpose. So similarly, JREDA can also do this money for financing the schemes on solar powered healthcare services, or energizing or electrifying public health centers in districts. So that's what ASAR also did one research and looked at into the money availability in the different districts. There is another point is about finance commission's funds provided to the state government. An increased amount has been provided, which are linked to the development goals. So that money can also be one of the avenues to finance or fund public healthcare systems in the state. And the third is the most important part where the finance can be raised, which not like in a government finance, but public finance definitely is a CSR fund. Jharkhand has a significant presence of companies, and these projects are typical projects, I would say, for the corporate social responsibility. And companies can take up or adopt districts and start and can provide solarized, I would say, health centers and health services both.
Right. Okay, thank you. I had another question, actually, it's largely from Divya. It's basically on like, how do you bring this particular issue in a public discourse, especially on the campaign communication? Because unless until we make it like as a debate for the society and public at large, I mean, I think till then it is not going to be, like we focus as a part of the government is concerned. So how do you basically amplify the overall campaign and the issue as in front of the policymaker? So what should we be doing actually, apart from some of the point which you said, or anyone can say? I mean, of course, Divya, you can start with.
Sure. Yeah, I mean, I think the first, Sanjeev Jainty is here on the call as well, and we've talked about Chhattisgarh quite a bit in terms of the work they've done around solarizing the public health centers there. And I think there needs to be more awareness about these kind of solutions. And like a lot of the speakers said, it's going beyond just rooftop solar or solar panels on these centers. It's about an entire ecosystem of energy efficiency as well as renewable energy solutions that improve healthcare services. I think it's telling these stories around using healthcare as a focus, not energy as the focus. Like using how are we improving healthcare? So it's going beyond just basic levels of healthcare service delivery, but like increasing that increasing the level of service that you're able to provide to those populations. I think telling the stories from the healthcare perspective rather than from the energy perspective makes a big difference, especially now when COVID has impacted a lot of rural areas as well. And healthcare is being talked about quite a lot. Now is the time when we need to be talking about the fact that our healthcare facilities are not up to a certain standard because of lack of electricity or lack of medical equipment, or just we have our PHS guidelines and we have all of these policies in place, but the actual implementation needs to happen on the ground is not happening. And those are the stories that we need to be talking about.
Yeah, Rama, just to add to that, I think Divya's absolutely right. For a while, when, back even say 4 or 5 years ago, sort of the image of renewable energy in terms of a positive thing was children being able to study in the evening. That was sort of what captured, this idea that this electricity solution is actually delivering education and therefore improving lives in a significant way. I think, of course, I think very similar to that, the image that needs to capture our imaginations is how this is helping healthcare being delivered, especially since currently, we're in the midst of this public health crisis. I think what we really need to do is find a way to tell that story of how renewable energy is solving problems, solving health problems, and solving it in a way that's even more effective, more economically viable, making those arguments, because I think, that there is openness. We've heard it from the members of JREDA, we've heard it from Mr. Sanjeev Jain. So there's a lot of openness for the solution. And we really need to be able to tell the success stories and say how it's changing lives.
Right. Good. Yeah, thanks a lot, Binuta and Divya, for this. I think it's really useful and helpful. So I see there are 2 more questions. One is from the Anand. Anand, can you go ahead and ask your question? Because I'm not going to read out, because you can directly raise this question to whoever that you have.
The question. Thanks, Rama. So the question was to Bharatesh ji. So from your experience installing these projects across the country, the initiatives have been mainly coming from JREDA, or have the hospitals realized over a period of time that there is an alternative to diesel and de-electrification, that they can switch to solar? I mean, the initiative has come from your end or from the hospital management's end?
Yeah, basically, what we have done in the geographies where we worked, we identified the NGO partners who are running this the NGO PPP, the PHCs. We largely focus on the PHCs and also the community health centers and the sub centers. What we have focused basically, it's largely through this NGO partner PPP model where we implemented these things. And idea was basically the Selco's work on health. I think it's just last 2.5-3 years. Idea basically initially to implement this and show some kind of models, various kind of models on this, and so that later on, based on the learning can be captured and can be replicated at the different stages. It's largely through working with NGO partners what we have done. And when later on, basically the NGOs which are implementing these PPP models, now they are also realizing the importance of the DRE. Now next level basically to involve in the various meetings, advocacy and a convergence meeting, and bringing that learnings, what we to bring those learnings to the table, especially with the government department. That's what we are planning for in this year. That's what the plan is basically. Yeah, it's more of initially we piloted the need in these geographies. And we also touched upon various other, not only PHCs, the primary healthcare or community health cares, but we also thought we implemented some other solutions also. Like one is basically the different kind of health facility, like boat clinics are there, and also the mobile health units are there. Basically, we also have a different kind of typologies based on now it's a time of consolidated these learnings and bring to the table to the policymakers. That's the plan what we have. Yes, it's more of like, it's working through NGO and NGOs who are implementing the PPP model basically. That's what is being initiated earlier. Now there's a time to, like, as everyone rightly pointed out, like, we have to bring a credible evidences and show the way how it is really helping. That's something which we are really looking forward especially in the states we are implementing right now basically. Yeah.
Thank you, Bharat. Yeah, I also had a message from Saksham. I totally agree that, I mean, whatever that Divya was talking about, highlighting the successful story, we also need to talk about the failure story as well, so that we keep learning from that. So thanks a lot, Saksham, for bringing that.
Rama, just one more point on that, if I can. I think we set the bar for ourselves really high when it comes to our work and talking and, saying what success really means. So it's more about the different kind of work that we're doing and the innovation that we're doing. And we're, on the financing side, we're seeing that there's more high impact, high risk, low return financing that's being thought of. And that's why it's really important to also, highlight the work that is in progress on how the impact that is happening, even before it achieves success in our, in our parameters. And it's more about, showcasing the different volume of work that is happening, because there's so much happening across Jharkhand. And that's, one of my asks to all of the practitioners here, to really showcase your work that everyone's doing.
Right, thank you. And also thanks a lot, Ananya from Clean Network. I mean, of course, we look forward to have support from a wide range of stakeholders. And I would also urge people who have not joined our Energy Collective Bihar and Jharkhand from this particular webinar, whoever is here, please do join our Energy Collective. We do have a lot of people on that platform where we are discussing issues related to DRE and other renewable energy on a regular basis. But definitely we look forward to work with you all. Yeah. Are there anything else, any other questions from the people? There is one question from Parmanand sir, actually, from Jareda. Parmanand sir is here?
Yes.
So the Parmanand sir is basically the ex-regulator. He used to work with the BRC. I think it will be important to know how the regulators see actually all of these things.
Actually, my question was from this in Jharkhand, Jareda, that there is since being the solar power is very cheap and reliable power, and health sector is seeing towards them for their support. There is a huge gap between the planning and the actual. So, is there any priority from the Jareda to provide more power, reliable power, solar power to the health sector?
Basically, sir, we had previously also said that JEDA was not basically focusing on the health sector before. But as of now, seeing the situation all over the world, health sector is the most important priority for every sectors rather than energy or whatever it is. Yeah. So exactly, we are planning right now for the DRE solutions for the health sectors. And we are in the process of launching some schemes after the approval of the government. Exactly, we have devised a plan for this also. And we are also waiting for the approval from the government side in order to proceed further for this. Exactly, there are several decentralized locations basically in the state where the reliability is a challenge for the electricity grid. And this is known to all. So solar energy is the only solution for this one.
Yeah, yeah.
So basically we are planning with solar energy and storage for the health sectors and all. Not connecting with the mainstream grid or like that. We are not planning like that. We are planning with the solar energy and storage for the next phase. Exactly, we are in the process of this.
Okay, thank you.
And I can also say on behalf of Jareda,
any other questions, sir?
That since CEED is working with Jareda, and as Mukesh was talking earlier, that Jareda is thinking in the direction of having a kind of a roadmap. And for that, we are having a discussion with Jareda and Health Department. So I think it's early days. So it will take some time before we proceed towards that in a much more organized and coordinated fashion. So hopefully in future, we will hear a lot from Jareda as far as DRE and health sector are concerned. So I personally look forward to to take this work forward and work with JREDA in a much bigger way. Any other question? Because we are going to close in 2 minutes. Yeah.
And, yeah, and I was just also interested in the support from everybody that what programs and what solutions we are proposed in a situation like Jharkhand, because reliability is at all a challenge, and right now no electrification is done at all, but there is still we are facing challenges because of the terrain of Jharkhand. Solutions that physically suit exactly in line of the terrain of Jharkhand would be required, and a collective coordination for all is required for this. So I will suggest for support from everybody for this in order to proceed further.
Thank you, Mukesh. Thank you, Nilesh. So there is one special request from my team actually, to have a video open for all of you so that they can take picture for some social media also. Is it, please open your video just for a minute so that they can take picture. Ankita and the team, please take the picture quickly. Is it done, Ankita? Thank you. Thank you. So now there is nothing else. I think, yeah. Thank you. So I think we have come to an end of this particular webinar. I think we have had a very wonderful discussion on various issues related to DRE and health. And as a kind of an indication from JREDA to basically work together in a much more collective way, whereas JREDA is also open to have of developing a kind of a roadmap, DRE roadmap for health sector. So I think these all are very positive indication, and definitely what we are going to do, the one that we are going to basically share a report and the recorded version of this particular webinar to all of you. And in future also we are going to have more and more regular discussion with JREDA and Health Department in Jharkhand, and also with some of the other identified district where we can do some pilot and all. And Selco has agreed to basically to support such kind of a pilot if it is proposed. So we will definitely going to work on that. Apart from that, we'll also be engaged with JREDA on various other policy issue. If we as a group feel that we need to have a separate policy for health sector, whether such policy has to come from the health department or from the energy department. So we'll work it out, and we will work for even new policy and program if it is required. And I think there is quite a lot of openness. And I'm also glad that a lot of people who are here are already working in Jharkhand. So that's a fantastic thing, right from WRI to CLEAN to Future for Forum, Selco Foundation, Selco. I mean, all of the people, I'm really sorry, I can't name all of them because I also don't remember actually all the name, but I know that a lot of people who are working in Jharkhand towards, DRE deployment. And I believe that we are going to talk to each one of you in coming days and months to take this issue forward. And we will keep you posted on the development. And so thanks a lot for joining this particular webinar. And we will be in touch, and definitely we will look forward to work with all of you. Thanks a lot. Bye and take care.
Thank you, sir. Thank you, everyone. Thanks a lot.
Thank you.
Thank you. Can't touch this one.